Can menopause increase the risk to develop autoimmune diseases?
This is the time when they may be uncovered or discovered. As we approach menopause, the level of estrogen starts to decrease.
Can autoimmune diseases get worse during the menopause time?
I think the joint ones, such as arthritis, rheumatoid arthritis, can definitely worsen a little bit.
How about patients with rheumatoid arthritis? Do they have limitations, in your opinion?
Can definitely be on hormone therapy. There's no need to suffer with it.
Welcome to Thriving with Arthritis podcast. I'm Girnita, your host, and today we will discuss about a very controversial topic about menopause. And we're going to answer a lot of questions. How is menopause affecting us as female? Is that increasing our risk to develop autoimmune disease? And if you have an autoimmune disease, will menopause affect you? And I will also talk, or we will also talk about hormone replacement therapy, if that's a solution or not, if it's indicated for people with autoimmune diseases or not, because that's a question that I get all the time from my patients. And we can also discuss about how we can manage well all these nasty symptoms from menopause. And today I'm delighted and honored to have with me a very special guest, a specialist in menopause, Dr. Cheruba Prabakar. Welcome.
Thank you so much for having me. I'm really excited to be here and discuss all these things about menopause and arthritis and autoimmune diseases.
Dr. Prabakar, she is a board certified OBGYN and a minimally invasive trained surgeon. She also specializes in women with fibroids, ovarian cysts, endometriosis, and pelvic pain. She is also a menopause practitioner certified by the North American Menopause Society. And she also owns a boutique practice where she provides highly specialized, accessible care and, like she likes to say, unhurried care. She's also a fibroid coaching. She has a fibroid coaching program where she spends a lot of time to answer all the questions related to this topic. And not only that, but she's a speaker and an advocate for women health issues. She lives in Oakland with her family, and she's here today to answer our questions. So
Great.
First of all, I want to say that I am really impressed with your background. It is very important to talk to someone about menopause because a lot of the patients that I have will either transition to menopause and will come to be evaluated for an autoimmune disease or will have an autoimmune disease and now they transition into menopause. And it's very hard for me to understand what is related to autoimmune diseases and what is related to menopause. And my first question will be related to, can menopause increase the risk to develop autoimmune diseases?
Yes, that is a great question. So, as we know, women have estrogen from their ovaries throughout their reproductive years, and this is very, very protective. It helps our heart, our bone, our brain, and we also know it helps our joints. It keeps everything lubricated. So, as we approach menopause, the level of estrogen starts to decrease. And so, I won't say that menopause increases the risk of autoimmune diseases, but this is the time when they may be uncovered or discovered. So estrogen may have been compensating for some of those pains and aches, especially with arthritis. And then when the levels of hormones and estrogen drops in menopause, things start to get a little more sticky or painful. And so I often see that in the late 40s to the fifth decade, in the 50s, women are presenting with new diagnoses of rheumatological conditions. And they are now being exposed more so because estrogen is dwindling, if that makes sense.
That's very, very good to say because a lot of females, once they transition to menopause, they are afraid that they will develop another condition or a chronic condition like an autoimmune disease. Now, I have to tell you that I have patients that will transition to menopause, and many times the things become complicated.
Hmm.
And my question to you is that can autoimmune diseases get worse during the menopause time?
Yeah, I think it depends on which ones we're talking about. So I think the joint ones, such as arthritis, rheumatoid arthritis, can definitely worsen a little bit again because of the lack of estrogen and the lubrication of the joints, and just in general how our muscles and bones and everything, joints work. So that can be. When we talk about other diseases like lupus, for example, I'm not really sure that that is going to worsen in menopause. However, autoimmune diseases can be challenging in terms of treatment of menopause.
That's true, because a lot of our conditions they do have symptoms like dryness of the eyes, dryness of the mouth. We have patients with rheumatoid arthritis or Sjogren disease that will complain about vaginal dryness, and during menopause, all of these symptoms will be worsened. Do you have any recommendations for patients about how to approach that?
Yes. So many patients ask me about hormone replacement therapy, right? Menopause hormone therapy, which is the gold standard for a lot of the things that we talked about: the dry skin, the vaginal dryness, hot flashes, sweats, mood swings, brain fog, all of those things. And so I want to let the audience know that hormones are very, very safe. And you should definitely be discussing this with your gynecologist, because as you start to experience these symptoms, there's no need to suffer with it. So, for someone who's experiencing the symptoms you mentioned, definitely seeking some hormone therapy is very, very important. Now, for those with rheumatologic conditions, though, this can be a little complicated because we have an increased risk of clot formation with some diseases. I'm thinking specifically of lupus, because we have patients with lupus, and then we don't want to add estrogen onto that because then you can really worsen your risk of clots. But there are still other options for hot flashes that are non-hormonal. So I really encourage everyone to speak to their gynecologist about all the options out there, because I really believe we are at a time in medicine where there is something for everyone and no one should be suffering. You mentioned vaginal dryness, and we have vaginal estrogen for that. So even if you're not a candidate for systemic estrogen, so taking an estrogen pill or a patch or something like that, everyone can use vaginal estrogen. Vaginal estrogen is safe. It's not going to increase your risk of cancer. It's not going to increase your risk of clots. So even if you're somebody with lupus, you can still use vaginal estrogen. It's a very low dose. And so at least that, everyone should be using.
I'm very happy that you opened the box for this discussion because for a long time we were taught that hormonal replacement therapy increases the risk for breast cancers and increases the cardiovascular risk. I remember particularly about the study, I think it was published in the 2000s, and that study was recently revisited. The initial study said that hormonal replacement therapy will increase the risk of breast cancer, will increase the risk for heart disease. But as I find out, and as patients were asking me more and more, I figure out that whatever I learned 20 years ago does not apply anymore today. So please let us know how the change. Please let us know how these things change over the last 20 years.
Yes, you're absolutely right. This was the WHI study, the Women's Health Initiative in the early 2000s, where everybody was freaking out because they said, oh, it's really bad for you. Hormones are really bad. Everybody stopped their hormones. Doctors stopped prescribing them. And this was a very, very unfortunate thing because the data was misinterpreted and there was a lot of fear. But as you mentioned, this has been revisited. There have been several follow up studies that have actually been done that show that it is very safe. And in fact, it protects the heart. And the risk of breast cancer is so minor. It's, 1 in 10,000 women over a period of 5 years. Which is nothing compared to the average risk of breast cancer in the US, which is 1 in 8. So that is a much higher risk than anything you will face from hormones. And we also have a lot of safer options. So before, the standard was an estrogen pill. Now we have an estrogen patch, we have an estrogen ring, we have an estrogen gel. So there's many different types of estrogen that we can use that are much more safe to use. And so women should really not be afraid of using hormone therapy. There are very few women who cannot use estrogen. For example, somebody with an active clot, like a blood clot. And so you should definitely speak to your doctor, but I think there are way more women who are scared of this than really need to be.
It's very important that you mentioned that there are so many options, but where would females find the best option? And you mentioned to go to talk to the doctor, but as you know, there are so many practices that are not quite qualified to prescribe hormonal therapy, but they do it. So, what would you recommend from the specialist point of view? Where should this female go and get the treatment that they need?
Yeah, this is a very important topic because there are gynecologists out there, who are trained to prescribe this, but there are also a lot of other practitioners, who are doing a lot of quote unquote hormone therapy, and the practices are not necessarily evidence based. So I would recommend that everybody look up the NAMS website, the North American Menopause Society. There's a directory there where you can find providers in your area who have taken this exam. In my bio, you mentioned that I'm NAM certified. So we study there's a special certification, there's a special exam you take. And so you're really up to date on the latest and greatest. And this information over the last 20 years has changed a lot. So I would recommend going to the NAMS website and, finding a OBGYN who is actually certified in that.
Thank you so much for sharing that information because that is extremely valuable for people to have. Now, for females that have an autoimmune disease and they want to try a hormonal replacement therapy, as you mentioned, the situation might be a little bit complicated depending on the type of disease that you have. And you pointed very well about patients with lupus. What the American College of Rheumatology did finally a few years back, they released a statement, they released guidelines for females that have rheumatological conditions and they need or they want to try hormonal replacement therapy. And as you said, lupus patients, if they don't have antiphospholipid syndrome or the presence of antibodies, they could qualify for that. But again, I think it's important to have that discussion with your doctor to weigh the benefits, to weigh the risk, and then make the assessment. How about patients with rheumatoid arthritis? Do they have limitations, in your opinion?
No, so patients with rheumatoid arthritis can definitely be on hormone therapy. And even for patients, without rheumatoid arthritis, many people around menopause start to feel joint pain. They go to a rheumatologist, they get all the blood work. Some people do end up having rheumatoid arthritis, others don't. They may just have another type of arthritis. But once they start the estrogen therapy, they end up feeling a lot better. And so it is not a contraindication for patients with rheumatoid arthritis. And I'm glad you also mentioned about the specific the phospholipid antibodies. And it's really a benefit and a risk discussion. Some patients are suffering so much that they'll take the risk and take, an estrogen patch because their life is otherwise miserable. They can't sleep, they can't, function. They're just have so much brain fog, hot flashes. So for them, that small risk is worth it. So really being able to think about what your priorities are and what you're willing to kind of deal with is important when you go see a physician to have this discussion.
We had that prior discussion about vaginal dryness. A lot of my patients with Sjogren disease, they do battle severe dryness. And what is bothersome to them is the fact that their skin is very dry and they have the vaginal dryness. And a lot of the females that I see, they get into more than that because, going through your life and having a sexual life, that becomes a problem. And you mentioned about the vaginal rings. Are there any other options for these patients that do experience a lot of dryness? And they want to, they want to have a normal life or close to a normal life and don't compromise the relationship with their partner.
Yeah, absolutely. So vaginal estrogen also comes in many different forms. The easiest way is a little pill that you insert in the vagina twice a week. It's not very messy. It's very easy, and patients immediately see, a good improvement with that. There's also creams that you can use. There's a ring that you can use and just leave it in for 3 months, which is really nice because you don't have to remember to put something in, every single week. And so there's all these different forms, and so there's options for patients who like one thing over the other. And a lot of times if you go on systemic hormone therapy like a patch, that will also improve the vaginal dryness at the same time, so you can get the double benefit on that. But yes, I recommend everyone to use vaginal estrogen really above 50, but especially patients with Sjogren's or other conditions where they have vaginal dryness, because we know that also the lack of estrogen can cause dryness around the urethra that can increase UTIs. And so it's just not sex and vaginal comfort, but it's also other things like UTIs, and then you need antibiotics and all of that. So this vaginal estrogen prevents all of that, which is great.
Do you recommend the combination of estrogen and progesterone, or what do you think about that?
Yeah, so this is an important thing I tell all my patients. If you're on estrogen, you must be on progesterone, unless you don't have a uterus. If you had a hysterectomy for fibroids or whatever reason you don't have a hysterectomy, meaning you don't have a uterus, then you can just take estrogen. But if you have a uterus, we want to balance that estrogen out with some progesterone so that the lining of the uterus doesn't get too thick, or can lead to endometrial cancer or anything like that. So we always want to balance those two things out. Yes. And progesterone can also help with sleep at the same time, so which is an added benefit.
That's true. And how about the follow up? How many times should the patient follow up with a specialist like you?
So after we initiate hormone therapy, I write only a 3 month prescription, and I tell patients to come back. Televisit is fine, just to see how they're doing. Do we need to go up on the dose? Do we need to take it down? Do we need to change the type of estrogen we're giving them? From a pill to a patch, or patch to a gel. So just to see how they're doing. But after that 3 month mark, then they just see me in a year. And it's also important to know that estrogen can slightly increase your blood pressure, very slightly. And so it's nice for also to monitor that. A lot of patients now have blood pressure cuffs at home, and so they can a televisit is fine. But yeah, 3 months, one follow up at 3 months is good.
During menopause, because we have so many changes, I think that a lot of us, we are also more prone to address our lifestyle. What are the lifestyle changes that you do recommend to your patients during menopause, when they approach menopause?
Yes, that is a great question. I think, along with entering your late 40s and into the 50s, insulin resistance also goes up. So we're seeing a lot more metabolic disease, high blood pressure, cholesterol, triglycerides, all this other stuff too. So definitely really making sure that exercise is more like a prescription. You're really doing that every day with a big focus on weights, for especially for women, for muscle mass and balance and all of that, as well as osteoporosis prevention. So exercise with a focus on weights, a good diet. I think we all probably eat more poorly than we think we do, so really examining the diet and making sure you're getting enough protein. And then a huge part is actually stress management as well. Stress, we always hear it and we say okay, okay, but really stress does make things worse, hot flashes even. And so finding, meditation or however it is that you relieve stress. These are the kind of the three pillars that I mentioned. I encourage patients to work on, and sleep also definitely. And we can often help sleep with the hormones that we give.
Yeah, those are absolutely great advices. I share the same kind of philosophy as you do. And many times patients do not expect to hear those things from a physician. So the fact that we are more and more that we talk about lifestyle when we manage chronic conditions, it lights me makes me so happy. Now, tell us a little bit about your practice. How do you practice? Where do you practice? What do you offer to your patients? Because I think that many patients will be very interested to find to work with you because you share so much knowledge, and it's clear that you know what you're doing.
Yes, thank you. So, yeah, I'm in the Bay Area, Northern California. My practice is in Lafayette, California, and I'm licensed in California, so I can see patients throughout California, including Southern California, San Diego, etc. So I started my own practice in 2022. I have a very boutique practice, and by that I mean that I spend 45 minutes to an hour with every patient. So in a typical medical system, I used to see 25 patients a day. Now I see 8 patients a day, and I'm really able to dive into their health a lot more. So coming to the GYN is a lot more than just a breast exam and a pap smear. We do need to talk about the entire woman, all of the things that are going on, especially around menopause. And so in my practice, I see my youngest patient is 10, my oldest is 87. So I see patients through all phases of life, and I have a special niche in surgical gynecology. So all of the things we mentioned, fibroids, cysts, all of that, and menopause. I am NAM certified. And so I really have a passion for speaking the truth to patients in menopause and getting them the care that they need. Because as we discussed earlier, there's a lot of misinformation and women are suffering unnecessarily. And so yeah, so that's kind of my mission with this practice. And you can kind of read a little bit more on my website. And I also love educating women in social media. So I have a TikTok, an Instagram, a YouTube channel, all with the handle TheFibroidDoc.
Tell us a little bit about your fibroid coaching program.
Yes. So the fibroid coaching program, I started this because I would get requests on social media from people in New York and, other parts of the country where they would say, well, I have all these questions about fibroids. My doctor doesn't really have any time to talk about it. And so I can't technically practice medicine in all these other states, but I created a coaching program where I would just answer questions for patients on fibroids, or maybe they have an upcoming surgery and they want to ask me questions about that surgery or what they can expect, things like that. And so, yes, and I have a whole website for that, thefibroiddoc.com. And so you can definitely find all that information there too.
Thank you very much for giving us the time, for giving us your knowledge. Dr. Prabakar, we are in depth, and I hope to see you soon to answer more questions for us.
Yeah, thank you so much for having me. I really, really enjoyed this time. Thank you.